The kennel cough vaccine contains live attenuated Bordetella bronchoseptica. There has been concern that this weakened bacteria could be passed on to humans that may be immunosuppressed due to COVID-19 infection. There are a handful of case reports of Bordetella bronchoseptica infection in humans where people are immunosuppressed for other reasons, but this is extremely rare. So, if there are immunosuppressed humans within a household, COVID-19 infected or otherwise, it will be sensible to ask whether the dog really needs the kennel cough vaccine. Is the animal due to go into kennels imminently? Is the dog mixing with lots of other dogs? Some vaccine manufacturers recommend that immunosuppressed individuals avoid contact with vaccinated dogs for up to 6 weeks. At present, there are no reports of the kennel cough vaccine co-infecting a person with COVID-19, but of course, vaccination of animals with any vaccine from COVID-19 positive households is not recommended due to self-isolation advice.